Now you all will ask me question that Dinesh, you are teaching for last 25 years about pediatric practice. First, in your pediatric book, you have written 10 cases where they were pediatric age that time between 2 to 10 or something or 20, 15. Now, what happened to those children? Yeah. Some of you will ask me a question, especially who are with me for last 15, 20 years, that Dinesh, in many seminars, especially pediatric seminar, you presented pediatric cases. What happened to those cases? And some of you specially attended because you knew that I'm a child-centric guy who's doing pediatric practice in the center. You attended my live case seminar specially, and you brought those child for a live case, or you witnessed those children in a live case seminar. What happened to all those cases? Don't you think this question is valid? Do we answer, or we forget about it once the seminar is over? So those children which I saw 20 years back, now they must be between 20 to 30 or 15 to 30. What happened to them? Children in my book, children I presented in the seminar, and children which I took the live cases. I thought this should be the main part of my research work. And that's what I did for last many, many months. I kept in touch with them. Especially, I'm sure one thought will come in your mind, what happened to that octopus boy? With the case which took me all over world, a case which you still speak about, many of you. What happened to that autistic boy who started talking and became normal? They are in their 25s and between 25 and 30 now. Or what happened to that cancer girl? And like that live case in many countries. That what happened to that coffee boy? And this is what I will speak to you about, in the last session, that what happened to this boys, what or girls, this children. Example, octopus boy. He's 20, not 23, I think he's now 26 or something. Yeah, he came to me at imaginary age. Of course, we are all seen the follow-up that he was much better. Then what happened when he was in early teenage? What happened when he was in late teenage? And what happened to when he's now adolescence, he's adult. Yeah. What happened to that octopus energy? What happened when he select his profession, study, profession, art, sports? Did they all have centered around his healthy energy or the octopus energy which improved? Yeah, this is interesting to see. We all promise, for example, here is that boy. He's now 26. And see, as I told you, I'm doing to call all those children and talk to them. See, listen to him.
I'm working on research on my further research on pediatric practice. Talking to all my patients which were 20 years back, 15 years back.
Yes, doctor.
Especially those who were children.
Right.
And now want to check where are they.
Okay.
So, we said that what difference it makes to them.
Right.
Since I saw you also when you were like around 4, 5. Right?
Yes, doctor.
So, overall, that age and that problem, pen sinusitis.
Yeah, I remember I had to get a surgery, and then because of your head medication, then I didn't have to actually get the surgery done. And I used to be very weak as a kid, and touch wood, I've not been.
So this is just that he was better. I'm not showing you whole. We'll wait for what happened. In many seminars, I spoke
I'm working
about,
on.
that if we talk about a holistic integrative module, and if we are selecting a remedy on integrative holistic module, a remedy which is perfectly fitting, then don't you think that it should bring a change at all the level? Yeah. And if a disease energy has become a healthy energy, and I kept telling in many of my seminar, did the disease energy become a gift? Yeah. Once you become healthy, eh, and these children who have selected now their profession, art, sports, alone space, spiritual space, are they have selected according to that natural healthy energy and moving towards that real unique individual higher purpose according to the energy which has got healed? Interesting to see. That's where the validity of what we are talking about, integrative holistic module, will come into picture. And this is what I'm planning to do, that we talk about in children is best because we get many years to watch them. Yeah. If time permits, I'll do some more cases, like a case of a thalamic hemorrhage. Yeah. In a child who is kind of early teenage. Yeah. And what happened, how the early teenage centric case taking approach helped to recover in the such condition which was 2 year old when he this I will do in there's a special part, uh, late teenage schizophrenia, and what difference the case that method did to him. The idea is that this is the right time. If we talk about integrative holistic homeopathy based on individualization and holism and searching that, then the whole method should be individualistic, child centric, age centric. And if it is child centric, age centric, and then the tool, yeah, totality making and remedy selection is according to age centric, child centric totality which is coming up, then this is perfect, the just right module. I invite you to witness cases where this just right module of case taking according to different age has been done at its best, where the standard question, artistic question, artistic method, and the diary questions are appropriately used. Yeah, whether it's the case of a non-verbal children, uniquely able children, children with imaginary age, early teenage, mid-teenage, late teenage, or the special module cases like uniquely able, trauma, psychiatric module, or the other videos like how we can explain homeopathy to children, what we do in homeopathic interview and the approach, and also what difference The child-centric, age-centric interview can have an impact on a child where that itself can become a therapeutic, a first dose of a remedy. And all these cases are new with follow-up of at least 1 year and maximum up to 10 to 20 years. Yeah. And not only we are talking about just a follow-up now, but we are talking about children over the period of 20 to 25 years. Yeah. With this, I invite all of you. I've been heard from my team that we already have 75 plus international people. So I'm very, very good, happy. And I'm convinced, like our all earlier ones, we'll have a lovely discussions and some of the masters also joining in, which I'm very privileged that they many times due to their, even with their busy schedule, they come and be part of it. Yeah. So all the best, and I look forward to meet you soon, either here or somewhere else to share about this journey. Big healing up to all of you. Bye bye.